Good morning, Nessa.
Good morning.
For everyone who's joining us today, this is our inaugural launch, and we're just winging it of What the Health. I'm Brian Bost. I'm a MedPeds hospitalist, global health previously, and some other things. I'm only double board certified, and so I'll let Nessa, who is triple board certified, introduce herself.
I'm Dr. Nessa Meshkadi. I'm board certified in internal medicine, pediatrics, and infectious disease. Nice.
AKA just the badass. Yeah, so we're gonna have fun. This is What the Health, a play on what the hell and what the health, where every time we come on screen, hopefully we'll just bring up about some information of a quick health topic, something that hits our eye in the media or the literature, and then a what the health or what the hell topic, which will be literally what the hell, and then closing up with some good stuff. So we're just winging it. It's actually a Saturday morning. We're starting with what the hell. I mean, I don't know. Do you have anything good health topic today that's hit your feed that we should talk about? We didn't prepare anything good today, just the opposite.
Well, topics I'm always thinking about are gut health, mental health, sleep, all those topics I'm interested in.
Good time. So, well, I'm going to just go to what the hell. So up on the screen for our viewers, I'll show you. Currently in Whitefish. I used to live up in Montana, and we still come up here. And so at the screen, you'll see this is our local Whitefish paper. And next, I'm going to show you one of the articles. So this is an article that caught my eye in our paper, and as you'll see, the title of this is Understanding Common Men's Health Concerns. Very catchy, very topical. I mean, we're always the center of conversation, right? I mean, men's health has dominated healthcare, right? All right, so let's focus in. Let's look at this article specifically in the very closed caption. Look at what is in this. Monitoring prostate health with regular checkups and PSA test helps catch problems early. At our pharmacy, we work with providers to offer personalized treatment options. So what the hell? Nessa, do you want first stabs at what the hell?
I'd like to just say that it's really important for all of us, even in healthcare, outside of healthcare, to be able to read something and understand the validity of it. And so this is a great practice. I just want to start by saying that.
Right. Yeah. So what the hell? So viewers on the screen now, you'll see this is the recommendations from the U.S. Prevention Services Task Force. Screening guidelines and healthcare recommendation guidelines come from specific bodies of medical people. So Nessa, IDSA Society, for an example, give us a recommendation from IDSA Society.
A recommendation from IDSA. Well, for example, if you're on broad spectrum antibiotics, you should probably de-escalate early.
Right. So that's an expert consensus guideline. It's based in not just best practices, but also lots of data. So the U.S. Service Prevention Task Force is a clearinghouse, so it brings in lots of guidelines. And you'll see this is for men aged 55 to 69. It gets a grade C recommendation. We'll talk about that in a second. But basically, it says that you, as a physician, these are directed towards me, I should discuss the potential benefits and harm of PSA testing with men from the ages of 55 to 69. It actually gets a grade D after the age of 70. And the reason for that is because there's a small potential benefit and because there are actually harms associated with screening. And so on this slide here, we see that what does an actual grade C recommendation means? It means there is at least moderate certainty that the net benefit is small. So back to my local paper today, where a compounding pharmacist is writing an article on men's health, certainly a topic that I don't mean to minimize, but for me, it is always follow the cash flow. And as the article says, if we go back to a little bit earlier, how does a compounding pharmacy have a specific way to make men's PSA or prostate health, specifically prostate cancer testing, become a topic that they're involved in asking patients to speak with their clinicians? So I label this a what the hell. I don't need somebody coming to me and saying the compounding pharmacist says check my prostate.
Yeah, it does sound a little suspect for sure.
So In our brevity of podcast, we're going to wrap up with two good things today. Nessa, tell us about your delicious looking salad there and what's going on with that.
Yeah, and on the topic of gut health, I think just eating fresh greens is probably one of the best ways. So this salad has greens that I harvested from the garden, feta cheese, pomegranates, which is in season, and all of these things are really good for you. And if you wanted to add a little bit more protein, I like to sprinkle sesame seeds or chia seeds on top and just make a homemade dressing and you're good.
What do you use for the dressing?
I like anything, even just lemons from my lemon tree and olive oil, or any vinegar and oil with a sweetener is great, or mustard even, or yogurt. You can add yogurt to the dressing and that'll add some more protein as well. So it's kind of a great way to increase your protein intake and mix it with fresh greens.
I love it. Now, the really challenging question. So I went through a pomegranate phase, as I think, a lot of us have. I believe that when I tried to harvest the pomegranate seeds, it actually looked like a small murder scene in the kitchen. I tried the spatula method, and I just, thank God, pomegranate juice comes out of most of the woodwork and the walls and the countertops. What's your method of getting the seeds out?
Yeah, I think it's in the way you cut the fruit. It helps to cut on top and bottom and then on the sides. And so you break them up really into small pieces. But sometimes I wear gloves. But the seeding of pomegranate is actually an act of love because it takes so long. So it's almost like a meditation. You're just like slowly taking away, and I'm always just like meditating while doing it. And it becomes like because it's so hard, it's just even that much more delicious.
I love it. That's awesome. And then we'll wrap up with the photo I shared with Nessa a little while ago. Is me walking our Doberman Rescue Canelo outside. And, Nessa, you're better at this than me, but what's the health benefit of my morning walk in fresh air?
Yes, for sure. I think walking is one of the highest things that we could do to help our anxiety levels. Just if you have high anxiety, even if you just walk around the block, that will disrupt the neural pathway that causes anxiety. So it's actually like scientifically proven to calm your nervous system. In addition to all the other benefits of being outside, fresh air, being around nature and exercise, which is good. There's just so many benefits to that.
Love it. Well, Nessa, anything else for us to wrap up with on this Saturday morning?
No, I think this is going to be a great series, and I hope people tune in for other What the Health episodes.
I love it. So Nessa, have a great rest of the day. And as you follow us along, you'll understand more about how Nessa and I's friendship began and the path and the journeys that we've taken and why we are collaborating to discuss health with a double L after the E.
Yes.
All right, Nessa, have a great day. You're the best.
Cheers.
Bye.